Future nurses, let's talk about the 7 class of respiratory medications you may see on your nursing school exam and on NCLEX, okay? So this is a pharmacology class you do not want to miss. And as always, I have NCLEX review on these 7 class of respiratory medications on my YouTube channel as Scrub and Spoon. Go review it, okay? Now let's clock it. The first class of respiratory medication we'll talk about is antitussive. Now these are cough suppressants. Okay, so antitussives are used to suppress the cough reflex and decrease frequency of dry cough that disturb rest and disturb sleep at night. Now, example of antitussives includes, I hope I pronounce these medications right, dextromethorphan, benzonatate, and codeine, which is opioid antitussives. Now, side effects of these antitussives includes sedation, dizziness, drowsiness, nausea, constipation, especially with the codeine antitussive, respiratory depression, which is with the opioid antitussive, and that is codeine. Okay, now let's talk about patient teaching for antitussives. You want to encourage the patient or teach the patient to avoid driving or operating heavy machinery because this medication causes sedation. Now, teach patient to avoid taking these medications with alcohol or other central nervous system depressants. Okay, avoid alcohol because alcohol also suppresses the central nervous system, and these medications can also suppress the central nervous system. So we do not want severe suppression of the central nervous system. So avoid alcohol when taking these medications. Now, also let your patient know that antitussives are not used for wet productive cough. They are used for dry cough, because in wet productive cough, we want them to be able to cough, but antitussive suppresses the cough reflex. Okay, and lastly, let your patients know that for codeine antitussives, there is risk of dependence, so patients should take it periodically or not too often. Now, the next class is expectorants. Now, they are used for wet productive cough related to some respiratory infections. Okay, and they are also used for common cold and bronchitis. Now, their mechanism of action, they decrease the viscosity, that is the thickness of the mucus or respiratory secretions, and it makes it easier for it to be expelled out or to be coughed out. Now let's talk about their side effects: nausea, dizziness, headache. Okay, now patient teaching. Encourage your patient to increase fluids because fluids help to thin the secretion and makes it easy to be expelled out or to cough out. Now the next class is mucolytics. They break down mucus chemically. Example of mucolytics, which is acetylcysteine under the brand name Mucomyst. And the second example is Donase Alpha under the brand name Pomozyme. Now let's talk about their use. They are used to thin or break down thick, sticky mucus in COPD, cystic fibrosis, pneumonia. And I also need you to know that acetylcysteine is also acetaminophen, that is Tylenol antidote. Okay, now let's talk about their side effects: bronchospasm, nausea and vomiting. Now, patient teaching. You want to teach your patient to use bronchodilators first before mucolytics, because that will help to open the airway first before mucolytics helps to break down the thick, sticky mucus in the airway. Okay, and you have to warn your patient that the acetylcysteine smells like rotten eggs. Now, the next class we talk about is antihistamines. Now, what do? They block histamine, the H1 receptor, and reduce allergy symptoms. There are 2 types of antihistamine. Now, there is first generation antihistamine and then second generation antihistamine. Well, now, what makes them different? The first generation antihistamine contains sedative property. They cause sedation, and they also have anticholinergic effects. That's for the first generation antihistamine. An example of first generation antihistamine is diphenhydramine under the brand name Benadryl. Now, for the second generation, has no sedative effects. They are not, it does not cause sedation. Now, example of second generation antihistamines are cetirizine, that is Zyrtec, under the brand name Zyrtec, loratadine, under the brand name Claritin, and fexofenadine, under the brand name Allegra. Okay, they are used for allergic rhinitis, that is runny nose, motion sickness, urticaria, which is hives. They are also used for sneezing, itching, and watery eyes. Now let's talk about their side effects. For first generation antihistamine, sedation is one of their side effects. So like I told you, first generation antihistamine has anticholinergic effects. Can see, can spit, can pee, and can poop, which means Can't spit, they cause dry mouth. Can't see, they cause blood vision. Can't pee, cause urinary retention. And can't poop, constipation. Now, patient teaching. You want to encourage your patient, because the first generation antihistamine cause sedation, to avoid driving or operating heavy machinery until they know how this medication affects them. They should also increase fluids and fiber, because it can cause constipation. Also, encourage them, do not mix this medication with alcohol or other central nervous system depressants. And they should report difficulty urinating because of the anticholinergic effects, urinary retention. Now, the next class is decongestants, okay? Now, what do? They cause vasoconstriction of the nasal vessel, and this will lead to decreased swelling and congestion in the nose. Example of decongestants includes pseudoephedrine, which is Sudafed, phenylephrine, and oxymetazoline, okay, which is Afrin nasal spray. Let's talk about their use. They are used for nasal congestion from cold/allergies. Side effects may include nervousness, tachycardia, insomnia, hypertension, rebound congestion if the nasal spray is used for more than 3 days. Now, let's talk about patient teaching. Do not use the nasal spray for more than 3 days, just like I've said, to avoid rebound congestion. Avoid it in patients with hypertension or heart disease. Because it causes insomnia, encourage the patient to take it earlier in the day. Now, the next class we talk about is bronchodilators. What do? They relax bronchial smooth muscle, and this will lead to airway opening. They open the airway for easy gas exchange or proper breathing. The first we talk about is the short-acting beta-2 agonist, and this is the rescue inhaler, example albuterol, which is under the brand name Ventolin. It is used for acute asthma attack, and it's also used in COPD patients to open the airway. Side effects may include chest pain, palpitation, tachycardia, tremors, and anxieties. And like I said, it is rescue inhaler, so it is used first before any other bronchodilators or even corticosteroids. If your patient have to take bronchodilators and corticosteroids, you use the bronchodilators first to open the airway before the corticosteroids or glucocorticoids, okay? You have to wait 5 minutes after using bronchodilators to open the airway before using any other inhaler, or if your patient have to take glucocorticoid, you have to wait 5 minutes in between after using the bronchodilator before glucocorticoids. The next one we talk about is the long-acting beta-2 agonist. Example of this medication include salmeterol and formoterol. They are used for long-term maintenance dose and to prevent asthma attack, or to also prevent COPD flare-ups. The next bronchodilator we go to is the anticholinergic bronchodilators, and these medications includes ipratropium and tiotropium. They are used for COPD, asthma maintenance to prevent asthma attacks, and rhinitis, which is nasal congestion or runny nose, okay? Now, they have, for the side effect, they have anticholinergic side effects. They are anticholinergic bronchodilators, right? So they have they can't spit, can't see, can't pee, can't poop side effects. And they can also cause bitter taste and throat/nasal irritation. So patient teaching for anticholinergic bronchodilator is to encourage the patient to suck on candy, like sugar-free candies, and to increase fluids because of the constipation, because anticholinergics dries the body up. And the last bronchodilators we talk about is the xanthine derivatives. Example of this medication includes theophylline, aminophylline, okay? They are used for long-term control of asthma and COPD. Their mechanism of action is they increase the CMP, and that will lead to bronchodilation. Contraindications. This medication is contraindicated in patients with coronary artery disease. Side effects include GI upsets, headaches, arrhythmias, and seizures. I need you to know that they have narrow therapeutic range, which is between 10 to 20 mcg/ml. So you have to report theophylline serum level that is above 20 mcg/ml. Okay, and this medication can also interfere with caffeine, so encourage the patient to avoid caffeines when they are on these medications. Also, periodic blood draws are required during theophylline treatment to check serum level. Okay, and that concludes our bronchodilators. Let's go to last one, corticosteroids. They are anti-inflammatory. And what do? They reduce airway inflammation and swelling. Now, 2 examples. There is inhaled corticosteroids. Example includes fluticasone and budesonide. And there is systemic corticosteroids, which means it's taken either orally or via IV. And that includes prednisone and methylprednisolone. Okay? They are used for long-term asthma control, also for COPD exacerbation, and they can also be used for allergic reactions. Finally, they can be used for rhinitis, that is nasal congestion. Now let's talk about the side effects for inhaled corticosteroids. Oral thrush or oral candidiasis. It can also cause pharyngitis, that is sore throat. Now let's talk about the systemic corticosteroid side effects includes immunosuppression. Long-term use of corticosteroid will cause immunosuppression, hyperglycemia, osteoporosis, infection risk, and fluid retention. That's for the systemic corticosteroids. Now let's go to patient teaching for corticosteroid. Teach patients to rinse their mouth after inhaled fluticasone, which is corticosteroids, inhaled corticosteroids. Why? Because the residual medication can cause oral thrush, oral candidiasis on the tongue, and that's when you see the white patches, and that's why they should rinse the mouth after use. The oral thrush is a fungal infection of the mouth caused by overgrowth of the candida yeast. Okay, so you want them to rinse their mouths after inhaled corticosteroid. If your patient is using both corticosteroid and bronchodilators, always remember they have to use bronchodilators first, because that will help to open the airway, and then corticosteroid second, and wait 5 minutes and then use corticosteroid, because now the airway is open, the corticosteroid can be absorbed well in the airway to reduce inflammation. Okay, do not stop abruptly. In fact, do not stop any medication abruptly. We all know that. With corticosteroid, monitor blood sugar with systemic corticosteroid because it can cause hyperglycemia. Also, take oral steroids in the morning because it mimics the cortisol. All right, guys, that is about our 7 class of respiratory medication.